Okay. So I'm dropping the link to the agenda for today in the chat, and then we can just jump right in. And I'm glad we have at least one representative from all lever teams. So let me go ahead and share. Okay, are you all able to see my slides? Okay. Are you able to see the presenter view if I share like that? Do you just see the slides or do you see like
We see the tabs
Just
across
see
the top.
this.
what's that?
We see the tabs across the top.
Okay.
But no notes.
Oh, okay, perfect. Okay. So for our agenda today, we'll get started, get grounded, a few things about collective impact and how we measure that. And we're getting geared up to be set up to finish our Smarty goals. So we'll review every lever team goal together, and we'll be able to kind of digest and process together. There's also a number of notes from the NOCT, the National Oral Health Connection team, that wanted to offer some feedback to you all. And then we'll get into a discussion about alignment between all levers and how we can reinforce one another and strengthen the overall blueprint strategy. Also how we can leverage our mid-year meeting and our time together in person. So we'll have some next steps and come to a close. And so for our startup, a little chat box check-in. If you want to share a recent personal or professional win with the group, thought that'd be a cool way to start out.
Love the image.
Oh, yay, graduation. Congrats. I want to say my own both personal and professional win is making it through the middle of the week. Okay. Oh, that's so important. 2 good nights. Okay, cool. Well, feel free to keep sharing, but in the interest of time, we'll jump right in. And so, collective impact. I have this video. I'm hoping the embedded link will work for us, but just so I'm not talking a whole bunch and also grounding us in the whole initiative that we are taking on together.
The number and complexity of challenges facing our world can be overwhelming. When individual organizations attempt to tackle the most daunting problems, success stories are all too rare. Many innovative approaches have been tried, too few have worked. However, when organizations work together under the right conditions, they can accomplish great things. One particularly effective means of collaboration is collective impact. Using the collective impact approach, a number of complex social challenges have been addressed and some remarkable results have been achieved. Youth incarcerations dropped by 45% in just 3 years, with no change in public safety, improving the lives of thousands of youths. 6,000 public housing residents were placed in new jobs during the recession. More than 1,000 acres were restored and over 280 million pounds of pollution voluntarily reduced to conserve and restore a river. Organizations utilizing a collective impact approach do the following: agree to a common goal, agree to track progress in the same way, which allows for continuous improvement, do what each does best while identifying new ways to work together, have consistent communication, and finally, have skilled and dedicated resources to support ongoing efforts. The world's toughest challenges aren't going away. In fact, many experts predict they will continue to grow in both number and complexity. Solving these problems requires a range of expertise from a number of diverse organizations. Collective impact is a proven approach, helping organizations work together to move mountains.
I guess right there I could have.
Cool. Was the volume okay for you all? Yeah, cool. So collective impact. It's a big beast of a model, and also just the size and scale of everything to date. This is it's a monster, right? So just trying to ground us in all things, how we evaluate it, having this thing shape up using, the best tools that we have available. So collective impact initiatives, they involve multiple activities, programs, and initiatives, all of which operate in mutually reinforcing ways to change complex systems. So rather than use performance measurement and evaluation to determine success or failure, we use the information they provide, these evaluations, to make decisions about adapting and improving the initiative over time. So embedding evaluation and learning into the whole initiative's DNA. So there are 4 things that they recommend we consider when we are considering evaluation. And so we'll dig into them one by one. So the initiative's context, let me see if I can get, so the context refers to everything that influences an initiative's design, implementation, and effectiveness. So changes in context are inevitable, and they're often are important in supporting or hindering an initiative's success. And there we go. So the initiative itself is what we would be evaluating after that. And so for any collective impact initiative, changing the way that organizations and individuals interact with one another and approach complex problem solving is important, if not often implicit goal. So all of the process measures, like making sure that we're on track for the initiative itself, making sure all of that is embedded into the strategy itself. And then assessing systems level change, which is of course, very difficult. And most collective impact initiatives, they have hugely ambitious goals, just like we do. So not only do we seek to tackle complex problems, but also try to create large scale change. So making these systems level changes will create the conditions that allow collective impact initiatives to achieve their ultimate objectives. So I don't know if you've been like keeping up with all the sample outcomes and indicators, but I think those are important to keep in mind as we start to review these high level goals. And we'll be staying at the high level and working with them at a conceptual level before we start to get into specific outcomes and indicators, but please keep in mind. So a good example here is, they wanted the outcome that they would be influencing changes in attitudes and beliefs towards the desired behavior change. And so some indicators was individuals view things with increased importance, relevance, and sense of urgency, and individuals express attitudes or beliefs that support the desired behavior change. So you can start to think about like, okay, how do we document that? How do we measure that? What would that look like? And so the final thing that we want to consider as we consider evaluation is tracking progress over time using the initiative shared measurement system in addition to more robust evaluations. And this is looking at our ultimate outcomes, what we hope to achieve at the end of this road. So with that in mind, what you all will be doing today is going through the whole thing together. We'll process, digest, keep it at a high strategy level. And then when you go back into your teams, we'll have the next like 6 weeks or so to finalize our Smarty goals. And so remember that we have specific, measurable, action-oriented, rigorous, time bound, and inclusive and equitable. So those are the standards that we're holding ourselves to. Special emphasis today on measurable, so keep that in mind. And another good example here is a SMART goal would be to build a volunteer team of 100 door-to-door canvassers by May. And then to make it smarty, we would include with at least 10 people of color recruited as volunteer leaders first, so that they can help shape the way we run the canvases. So with all of that, we'll jump right into the open blueprint. And just to get started, the document has a lot of feedback on the goals themselves. And then these next two slides just have some high level feedback about the overarching strategy. So they wanted to emphasize funding, of course, what stuff is going to bring in money, map it out short to long term. They see this being like a bi-directional narrative that could speak to potential funders about what our goalposts are. So we're also reaching out to grassroots and establishing new member guidelines for the kinds of activities to implement on the ground. And everyone thought that this was, this was a great, how this is shaping up. Everything is aligned with the mission of Open. This is really great work to date. So I want to maybe start with that. Like, that's a huge win. So yeah, the NOC now sees this as the funding priorities. This is how we'll change the system. This is what will lead to the greatest impact, and it will require a whole lot of resources to carry out. So we want to make sure that we're not chasing money or grants, but we have a clear understanding of what funding aligns with this mission, and that we're strategically applying for that. And the NOCT, the National Oral Health Connection team, those members are, they have a fundraising strategy that they're putting together. There's already one grant concept that's come together for Bring Care to the People. It's a teledentistry demonstration model. But so there's plans underway. So the goals that we set here for the blueprint and for the network's work over the next 5 years, that's something that the NOCT will be able to support fundraising efforts for. So keep that in mind. They recommend adding a column to the Smarty goals to say what resources would be required to carry the workout. So is there stuff that we already have? Is there stuff that we could gather at little to no cost? If it would require people to volunteer their time or any other resources or money. And considering what aspects would not need to be funded and how can we leverage existing work among members to reduce the need for resources. I also realized while I was talking that I didn't pause for any like questions or anything on the last section. So I want to pause here to like just see a little pulse check. We all good? Good feedback, right? Fundraising. Okay. So their last bit of overall feedback was we could make a call to the network about any state or organizational resources, examples of work that align with the levers. We could do that at mid-years. So that was a recommendation. Also to identify what orgs are working on. And we want to look at where we're strong as a network, where do we already have presence, where are we weak, and then build strategically from those areas. They called out a need for a targeted, enumerated, and metric-friendly list, which I thought was nice. And then finally, a consideration for how our 5 levers intersect with the oral health in America. There's 6 domains there. So that'll be a major focus for federal money and philanthropy. So our planning really weave that report in as much as possible. Also, I hear some feedback, so I'm gonna try to see who's not. Muted. It's Belisa. Sorry about that. Okay. Okay. So with that, we'll jump right into all the lever goals. And so the red text, that's the Noct's feedback for each of the goals. Some of them didn't have feedback, and then the blue was notes from the team that they wanted to weave into the strategies, but we just haven't yet refined all of the wording and the total. So we're working at these at a conceptual level right now, and I think for us to process together, if somebody from each lever wants to read out and go through their one lever, like there's 3 or 4, I think, in each. So read those out, and then we can start to process and digest both the knocked feedback and anything that comes up, with an eye for like, how does this relate to your own lever? And then so we can just move one by one, if that works for everybody. So who on Amplify Consumer Voices wants to jump in here? And do you guys want me to zoom in a bit more?
Yes, please, on the zooming in.
Okay. Felisa, not to call you out, but I know that you're on Amplify Consumer Voices, and just to get some additional voices in the room, would you mind sharing out what we've come up with?
Yes, I would, but I'm having a little technical difficulty. I'm on my phone, so I can't see anything. So if you can give me a few minutes, I'm trying to iron some problems out.
No worries. Was anybody else on from Amplify? No. Okay. Well, I'll go ahead and read them out. So the first goal was to design a customizable model. The thinking was for the ROCT to lead state partners through this. And so having that model, that would be to strategically identify and develop strong community-based partnerships, especially focusing on ones that are often not at the table. And we want to understand their priorities, strengthen our own messaging, and encourage the inclusion of oral health in policy priorities. And then the group wanted to make sure that first we simplify open for local, state, and community partners, with group norms to engage on our platforms and in the same rooms. Also to set up for the next goal to establish that we have some desired outcomes with our new partners, that we want to do community-based research. That's the next one in there. And then the NOCT wanted to say that amplifying consumer voices, that we want to specify this is in all directions, all multiple directions, and customization is key. So the second goal is to design a customizable model. Oh, Belisa, I see you're popped up on screen now. Are you able to? You're muted. Sorry to put you on the spot.
I'm not on the spot. I'm just trying to make sure. This is the time of the day. Okay, so where are we at?
In the second goal in A4.
Okay, design. My cursor's not working. So anyway, my cursor's not working. So what I do see is designing customizable models, virtual tools for how to engage and educate community partners to maximize consumer involvement, conduct story banking, access mapping, ID environmental policy barriers to oral health, match community health data with communication loops for, and I can't see anything else more, and I can't navigate my system, and that's my problem, because that's all I can see on my screen. So I think.
Yeah, I can jump in. So having this virtual tool It would also have the communications loop for consumers to offer meaningful feedback, elevate their own priorities, and then we would subsequently share any resources developed and any advocacy plans back to consumers. So keeping with that multi-directional process. The group also included a thought to include steps or guidelines for how to evaluate and identify needs that can be addressed in state oral health plans, and perhaps having some kind of consulting model to be able to complete that work with potential state level funding. So there's some thoughts there. The third goal is to develop consumer-driven media campaign to showcase new understandings about why oral health matters to overall health, design progressive social media messages, toolkits, videos, write articles and white papers to raise awareness of the importance of oral health, common barriers, disparities, and viable solutions, offer education and training to improve racial and economic justice problems to different population groups. The knocked feedback there was that we couldn't possibly do all of this in a year, but structural goalposts for media campaigns, that was clear and useful.
And I could actually see the last part of it, if you don't mind.
Jump right in.
Promote and emphasize, consider use of updating open equity checklists, expand checklists to include equity audit and various stockholders, dental practices, oral health coalitions, health departments, and funders. Engage those groups in implementing an equity audit with guidance from the previous partners, coalitions that can assist with when needed. Could you scroll down a little bit more?
It's that can assist when need is identified.
Yeah, I can't see it anymore. Could you scroll down?
Is that better?
Is that it? Because I can't.
Yeah, that's the final one for.
Okay, yes.
So, okay. That was everything for Amplify Consumer Voices. So are there any thoughts that come up? Anything that you think is great about it? Anything that you think could be improved? Is there any relation to your own lever that you want to maybe lift up or perhaps weave in when you get to share out on your own lever? But any thoughts that are coming up for you all?
So, you know, the statement was we can't possibly do all this in 1 year. And so when my team got together and they had a conversation on this, we were just kind of stumped at first until you kind of gave us a little light that this is not something that we ourselves will do. It's something that we are kind of recommending to open to work together and kind of piecemeal this together. And we might have to do it among all the different levers. That's something, did I get that kind of correct there?
Yeah. So we have the ability to call together, endless numbers of people to be able to pull this work together. So as long as we have like clear, SMARTY goals. So we have our outcomes and our measurements and everything outlined. So we'll start to get into like whatever objectives and tactics. And so like with the customizable model and the media campaign, as long as, it's like you all are informing those models, informing those campaigns, but it would be the work of staff to pull it all together and to make sure that it's like designed and beautifully produced. So we'll be working together over time to actually implement these strategies. But right now it's you guys kind of are just making the decisions on behalf of this vast network. What is it that we want to collectively do?
Now, with that information, we felt comfortable with the information that we had put together. my team, we were comfortable with this information and with your support.
Great. Were there any other thoughts for amplifying consumer voices?
This is Heather. I'm with the medical dental integration lever, but the develop consumer driven media campaign, I know it says, we were just talking about that, but I think that could have a lot of overlap into all the levers. Just because, depending on what you find out and what's driving the consumer and what their needs are, it could easily overlap with some of the things that we're already doing. So I would love to see us work together, especially if it's something as far as not being able to find providers. I know there's different levers here, but I think there could be a lot of overlap and working together to, I know we have a media aspect to our goals as well. And I think it's important if you guys are finding out what the community's needs are and what the needs of the people and the consumers are, that information can help guide how we market, some of our other levers.
Totally.
This is Deb, and speaking for my third of the bringing care to people lever leads, I think the same thing as was just said. If we're going to bring care to people, we really have to understand. So there's sort of a bi-directional thing there too. What you're what we need to understand, and then what we need to offer, and then how that needs to be presented back and promoted.
This is Anu, also from the policy lever. I feel like policy is kind of integrated with everything, but for this, especially the advocacy piece of policy and the consumer voice kind of overlap a lot. I'm not sure I'm speaking for my group, but I think Crystal is here, so she can add it.
You are.
Yeah, that could be a good segue into advanced oral health policy, which I know does include emphasizing the consumer voice, but who wants to jump in for oral health policy? Was that you, Anu?
Yeah, I don't mind. I can see the screen. So for oral health policy, establish broad strategy to advocate for appropriate changes in federal, state, and local laws and regulations, and identify opportunities and design plans for network to assess and implement. There was a comment on who would be establishing this broad policy strategy. And I mean, should we answer that first and then go to the next comment, or how do you want to do it?
I mean, I know that it's out there, so keep these things in mind as we're trying to see the whole big picture at once, and then we can zoom back in when we're broken off into our lever teams to try to answer these questions.
Okay, so the second comment was consider what Open's unique capacity is to move the policy forward. And we may be better off supporting other groups. Inclusion of grassroots and advocating for policy should include analysis of what we are uniquely capable to do and more likely to get funding for it. That was the first point, first goal. I don't think there were any more comments on the other. So for the second goal, the second goal was emphasize consumer voice in our policy and advocacy work, collaborate with national, state, and local partners, get their buy-in or support, use their expense to inform how we lift up the consumer voice. And the third goal was identify, create, and share tools and resources to support members' advocacy efforts to illustrate a unified voice with policymakers. So any comments on the comments that we received? I think that was my first concern when we were talking about like an overall strategy as to who would be establishing that. Just speaking for myself, not even my group, is since this is so deeply integrated with all the levers here, I feel there should be some representation from each lever, just so we kind of work together. It's important to involve grassroots and state reps, but I feel like as this organization, even from each level, we need to have some representation. That's just my thinking, and I'm, we're open to comments.
Yeah, I mean, I agree. I think each lever, especially with, our level, this is Heather again, our lever, as we come across things that we feel need attention, right? Through policy, right? Where we're maybe stuck on something or can't move forward our goals without a policy change, or we identify a policy that needs to be changed. I think this would be a great opportunity to speak with not only the lever for policy change, but then, however you guys are coordinating with the policy NRT, things like that. So I think each lever, as they come across things, or even consumer voices, if you find something that seems to be important to the community that needs addressed throughout policy, I think you're right. There's deep level of integration there.
Thank you. Vanessa's here too, so I'm not sure if she wants to add anything. Vanessa, we're just going over the policy piece of the framework. So if you want to comment on the comments that we've received, we're just discussing that right now.
Yeah, no, Anu, thank you, but you did beautifully. I looked at it before the meeting. I apologize, I'm just coming out of another meeting, but you covered everything, and thank you.
One thing I do want to ask was, we are talking about funding here. So at least that's what I've seen in academia and Tenel Public Health, is not normally we look at the funding and then we decide what we're going to work on. It's not the other way that, okay, I want to work on this topic and then I go out and explore funding. So that may be a place to start. If we as a group decide this is something that we can work on, that may be the starting point.
Any other comments for advancing oral health policy? Great. So then integrate dental and medical. Who do we have? I think that was Heather, right?
Yeah, am I the only one here?
I think so. Yeah, I know Lindsay is traveling today.
Oh yeah, she wasn't sure. That was correct. Okay. So this is design and launch a virtual open source repository of successful and emerging integrated medical dental care delivery models to highlight oral health as key to overall health and integration as key to improved health outcomes. These models will include, but not limited to, practice types, provider groups involved, specific population served, data sharing, care coordination, and enabling services, and enabling policy and legislation of community and state levels, promote broadly to provider groups, policymakers, advocates, community-based organizations, etc. And it looks like the national team had some notes here. And I think they've given these notes before, saying interprofessional collaboration, caring for the whole person, which I think is helpful in how we word things, because it is important. And then integrating primary care, oral health, behavioral health, and social services. They said that's too broad.
I think they were asking if like this, the recommendation was to say instead of integrate dental and medical,
Yeah.
because medical is so limiting, to say integrate oral health, primary care, and behavioral health.
Yeah.
And then if we also say social services, was that too broad? But also that
Right.
applies, but
So, I mean, I agree with that. I think we're not just trying to get oral health into primary care. We're advocating for whole healthcare, right? The whole body. So I would say social services are definitely a part of that. And then breaking down silos, amazing resources. Now to talk about oral health in all areas, integrate oral health, primary care, and behavioral health. Okay, and then the Harvard Library for Integration, which I just learned about. I was on one of the calls for CareSource, and they had somebody from Harvard on there, and they have a whole library of integration documents. So those could be useful. And then identify and promote successful and emerging integrated medical, dental, and interdisciplinary training models, curricula, and tools in the field of medical, dental, nursing, pharmacy, and other allied health and professional groups. And it says, we worked hard to separate oral health from dental care. Words matter, broader than doctors and dentists. I'm not exactly sure what they mean there. Do you know?
I think just to make sure we say oral health care instead of dental care.
Oh, okay.
We're
Got it.
not limited to teeth.
Got it. And then broader than doctors and dentists, which we did that. We tried to get broader than just the providers or the professional providers like doctors and dentists. So launch Learning Collaborative to explore repository of medical dental integration models, interdisciplinary learning curricula, and their enabling policy and coverage content in partnership with the ROC to support state level collaboration, increase understanding and support for integrated care coverage, create and promote such policy environment locally, the policy environment locally. And I think, is that, okay. And then examine how patients and consumer voice can be included in the integration of medical and dental care discussion. Also formulate ideas on a consumer informed message advocacy campaign that highlights the benefits of medical dental integration in collaboration with Open's Amplify Consumer Voice lever. I think that's it. If anybody has any questions, I think the big picture view was kind of design and launch something that can be accessed, kind of an open source that anyone can access, and then also identifying what we can put in there. But I think our idea was, wouldn't it be great if you were trying to integrate and implement something and you had a resource that would walk you through how to do everything? So kind of taking out that barrier of implementation or creation of a program. Does anybody have any questions or comments?
This is Deb, and would you scroll back up to the one where the feedback you got was about oral health versus dental health? I've long been saying oral health, but I've gotten some pushback within my organization that that's kind of jargony and that people think of it as dental health. But I get the difference. I mean, I get the distinction, but I'm just telling you that some feedback I've gotten is that, yeah, that's like too insider jargony, blah, 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 and that people understand dental health. So I don't know how to check that or change that or whatever, but just giving you the feedback that I've received.
Yeah, that's a good point.
I don't know.
Yeah, thank you, Deb. That is a good point. It makes me just kind of think that we need to focus on our wording and integrating our education, right? So like if we're referring to it as oral health and we're explaining why it's considered an important part of overall health, maybe that will catch on.
Yeah. I mean, I agree with the purpose. Totally. I agree with the purpose and that. Plus, I mean, there was a time when if you put in oral health, some search engines or within
Yeah.
a state thing would block it because it was probably having to do with oral sex or something. So they
True. I think it's getting a little bit more recognized, but that's a good point for us to consider when we're developing things.
Well, and along those lines, this is Jessica. I can tell you, like on our state Office of Oral Health website, it doesn't fall under oral health. And that's because our website gurus at our level, they did health literacy survey with constituents across the state, and it's under dental. That's not what we would list it under, but because the population recognizes dental, that's what it's listed as.
Yeah, I think that's a good point. I'm wondering, because our integration models I think we're going to be working more with the providers. And not that we don't want to know what the needs of the patients and consumers are, but it is a good point that we make sure that when we're addressing the consumers, that we make sure that we use language that's what they understand. I know if I talked to my patients and said oral health, they wouldn't know what that meant.
and the comment in the chat box, that's well taken. It's just, what do people understand? I get the intent of it and I like it because dental is kind of associated with going to the dentist. Yeah.
Cool. Any other thoughts for integrating oral health, behavioral health, and primary care?
Well, I have to agree with everybody. Imagine we're talking about the jargon that we're using, and it is too technical. And I think even for maybe some members of our, organization, the way we phrase things helps simplify what the task is. But going back to delivering, dental care, oral care to our communities. Now imagine trying to discuss that with foreign-born populations. So that compounds really what we're talking about, the issue of how we phrase things, how we frame things for our community and for ourselves is key. And so I'm really hoping that, we take a look at the main things that we are working on and try to see if we can, how do we phrase what we are saying to the persons out there in the street? And I'm talking about, in my opinion, bringing care to the people. If I want to explain to people that are not professionals, but I want them to be my partner in delivering the care, how would I phrase what I'm doing? And if I have long phrases and very technical, things to explain what we are trying to accomplish. So my idea is for us to go back to the drawing board and try to see how do we phrase the goals that we have in a simple manner in which people feel that they can participate and be part of it, part of the solution.
Well said, Beatrice. And this is Deb again. I just have to throw out this, that again, conceptually, I like it. I just want it to be understandable because we tried really hard in the beginning in Minnesota to have oral health practitioners, which would have been this mid-level dental hygiene with some expanded skills or whatever. And of course, it came out of the other end of the sausage making as a dental therapist. So yeah, words matter, but yeah, we can be
Yeah.
more on what we choose.
Deb, I thank you for that. And I agree. I was talking to an advisory board at Ivy Tech School where I am an adjunct, and I was talking about community health workers, and one of the dentists said, "Can you back up? I don't even know what a community health worker is." And I was like, "Oh, okay, yeah, let me back up." So I know sometimes even we assume that that they know all the jargon that I talk about on a daily basis, but I think that's going to be important how we frame and be intentional on the phrasing that we use. So thank you all for that feedback.
You know, when the amplifying group was talking, we spoke about the communication, and we recognized that it's really essential to have grassroots partners to be able to communicate with different communities, because you can be in one city and have different conversations or having different values of words. And so that is really key. You know, just like I did a program with the deaf, and the way to communicate with them was in Braille. You know, so you really have to really be focused on what audience you want to speak to, and speak to them in the way that they receive information in order to really get the message across.
I think that's great too, with like one of the Amplify consumer voice goals was to like to have this customizable model for interacting with different community partners, and the customization, right? That was the key that was called out there, right? All communities are different and all localities, and I think that's great to intentionally weave that. Are you all ready to move on to emphasize prevention? All good, okay. Chris or Alec?
All here. Yes, it's cool. Jasmine and Alec and I are all here. I'll read the first part of it, and then I'll hand it over to Jasmine and Alec to discuss the knocked feedback. Does that work? Okay, here we go. So our first priority was to advocate for preventative oral health services like silvadiamide fluoride, fluoride sealants, oral health education, oral hygiene promotion, and so on, to be included as a covered benefit by payers. And so the feedback from NOC, I'm going to have Jasmine and Alec go over that. You're muted, Alec, somehow. It's the microphone that's not working.
Hopefully this is better.
Much better.
Okay. So this first piece of feedback is prevention can go beyond oral health services. How we educate about prevention, utilizing massive workforce, say something about prevention modalities, excuse me, for whole person care of those that are specifically going to prevent oral disease, also specify for which groups, consumers, providers, etc. So within this feedback, there's a couple of things that I like that they highlighted for us. I think that they want us to clarify even more specifically that oral health services and preventive services doesn't have to be confined to just delivery of services, and that it could also be education, which we thought we had covered by saying oral health education and oral hygiene promotion. But I guess we want to make that a little bit even more explicit. So we can kind of go back to the drawing table and do a little bit more with that. And so for parts of the other things, I think that it's nice to always look at the whole person and to be able to maybe include one piece or some language to this task item of trying to say that when we're offering oral health preventative services, that again, the mouth is connected to the rest of the body, and that these are, you know, preventative services for everything. So I think that might be kind of what they're getting at.
Right. I mean, in my mind, whenever we're doing, like, whenever my group does, like, you know, training or any sort of presentations related to providing services, that does include like oral health literacy and having that discussion with patients. So yeah, I mean, I guess, yes, we can absolutely clarify that. Say something about prevention modalities for whole person care. I think it's, I mean, yeah, I think using the whole person care language is important as well. I think that is something that we should incorporate.
Ready for goal 2?
Yeah. So the second priority was to coordinate and develop initiatives that aim to train a diverse allied workforce tasked with delivery of preventative oral health services. And we very specifically use the term allied workforce. Jessamine or Alec, do you guys want to comment on that?
Yeah, I
I
think
don't
we
think
can both be able to kind of offer our thoughts on this feedback.
we've had this
and
discussion, no?
Well, I'll say this. I'm really glad that we're bringing this up to the all lever team so we can actually have a healthy discussion on this, because as we were just discussing, words do matter. And we specifically accounted for this. And in our own minds, I'm curious what other folks think on this call. When I think of a diverse allied workforce, that's a fairly inclusive terminology language. And I'm wondering how other folks think of that. That if that's what comes to mind, if it's whether or not it's just solely medical providers, or if that also includes social support services, for example, if you would include those in that language that we used. I'm curious what other people think.
Sort of love this question because I come from word people, but in a way, because in the dental world, allied health professionals is intended to mean, and I see Kate has an audience, so I'll behave myself and watch my language. The allied health professionals often meant assistants and hygienists and so on. And so if I'm understanding this is, we want this to really be inclusive of everyone that touches people who influences their oral health. So if it's somebody that's their community health worker, their care coordinator, somebody that's their nutritionist, somebody, I don't even know how broad do you want to be?
Yeah, I think that Deb, that's a good point. That's my question. Are we like, even back to the first goal, when you talk about being reimbursed, are we talking medical, dental coverage? Are we talking prevention as far as, are we wanting preventative services? Do we want dental preventative service to be looped in the same thing as a medical preventative service so that it's as important? Like, I think that you can really go really broad, or you can really go really specific. So I think maybe that's where the national is coming from, is how do you want to, who are you addressing? Is it everyone, the medical, dental, like we're talking about an integration?
Is it just making sure that when we get to value-based purchasing models that it's included, I mean, yeah, there's just, it's hard to, I'm not trying to muddy the waters, but.
I know I don't want to make it more complicated, but that's prevention is such a big, it's full of a lot of things outside of just oral care, right?
Right.
So
So
are
I might be able to, let me reiterate, so let's see if I'm hearing what you're saying. And so is it that our language that we used is somewhat ambiguous, that we didn't necessarily make it more of a clear idea if we want it to be more broad or more specific or more narrow, and that we should include more language to describe which direction we would prefer to take?
Yeah, it's kind of confusing, right? You guys were broad, or you were ambiguous for a reason, right? But then that being ambiguous in that created whether you want to be more generalized or specific. Right?
So we should be more intentional about being ambiguous if that is our intent.
Yeah, I don't know how we came to that, but yeah, I think that's exactly right. Deb, are you?
I'm
exactly-
laughing. I'm busy laughing because
I know.
I think that maybe it's the yes and sort of thing where we
I
want to
know.
be sure that the current payment model that might reimburse through specific providers that can do that, can apply that's covered. But I took the feedback about prevention going beyond oral health services might mean to, that there's so many things, like prevention could be not having soda machines in school.
Oh yeah,
Not having, you know what I mean? So
yeah.
maybe it's a yes and maybe this has, because I think,
Yeah, and so to even go even more granular, we had used the language payers purposely
Okay.
as one of the most broad terms that you could possibly use for that description of an insurance carrier, whoever is paying on a claims basis. And so maybe we should even further describe, what those payers are and what those services would be more for.
So it sounds like we slipped away from priority number 2 and went back to number 1 again. The term allied workforce was a specific term that we used. And I think, Jessamine, I'm sorry to throw you in front of the bus here, but you had some really good thoughts on that, especially from the nursing perspective.
Right. So the language that we typically use when we're talking about integrating oral health into professions outside dental, that includes everybody. It includes nurses, nurse practitioners, midwives. So we typically we use interprofessional most of the time for that terminology, and saying, so I don't know if it applies saying like training an interprofessional workforce, but it communicates that there's multiple professionals that we're including. And when we say it, we are also including like social workers and things. Care team, I just saw that. Care team also, we'll talk about using like bringing together the medical and dental care teams. Interprofessional, when we use that, that's what it usually communicates. It also, the inter part of it is it aligns with a couple of our other goals, which is actually physically having interprofessional communication and collaboration across medical and dental professions. So it's not just like, hey, you guys need to do this too. It's about, well, how can different professions communicate with one another about how they typically provide care and what works best for them in providing oral care. So something like interprofessional care team. I think that pretty adequately covers it. I think there's so many options for language use. We could go on for days and days and days, but I don't know. I'm of course partial to interprofessional, but of course open to what others think.
And keep in mind, we don't have to make decisions today. We're just making sure that we get all teams set up to have these discussions to get to the final Smarty goals.
But thank you. I wanted to thank for relaying what the NOC team was questioning about our word choice for allied workforce, that was messaged as actually as the dental workforce and not for the rest of the workforce.
Yeah, and I think it's like, if that's a judgment call strategy, like we're focusing on oral health and that's where it is, then I think just be as specific as you can be, but also, knowing that you're being intentionally ambiguous in some ways. It's a delicate balance. Did you want to get into the final two here?
We can, if anyone has questions about them. So priority number 3 was to promote blueprints and stories of innovative preventative oral health service delivery systems by amplifying their successes and advocating for research funding to investigate alternative models was one of them. I don't know if anyone has questions for the group on that one.
I don't have a question, but this is Heather with the medical dental integration. I think we may overlap in this area a little bit. So, you know, I would love to share information as far as us trying to create and find successful, successful models. So, you know, if you have a successful model that's adding preventative oral health to delivery systems, you know, that would be good to be shared, and vice versa, if we come across something that fits this.
Mutually reinforcing activities.
We did discover in our conversations that there is an enormous amount of overlap and integration between all our lever groups. So, which is actually kind of cool. The last one is about advocating for oral health to be considered within physical, behavioral, and social determinants of health screening utilized by healthcare institutions. What questions do you have around that one? Over to you, Francis.
Cool. So our very last but not least lever is bring care to the people. So who do we have here? Oh, I see Deb, Jessica.
Hi there, Francis. This is Beatrice too. I actually can share. I am driving, but I can help a little bit, and maybe my my team can expand on the things that we're working on. And we have on Bring Care to the People, Paul. The first one is to engage and learn deeply from scientific experts, clinicians, and community members to find consensus-based, tailored, community-centered health solutions. And on that, the top-rated area is offer virtual info share sessions for pediatricians, advocates, clinicians on different programs, considering integration with other services and how to engage with the community.
Hey, Beatrice, are you working off of the lever worksheet?
No, not really. Actually, yeah, maybe I can have. Is anybody, Deb or Jessica, able to read from them?
Go for it. Will you go for it?
Yeah, Deb or I can read from the group.
Excellent, thank you.
All right. So this item we have on here. Sorry, getting feedback.
I think you should be good now.
Okay. Is to expand the understanding among open members about current oral health science related to community-based prevention techniques and teledentistry facilitated delivery system ways to support mouth healthy habits and provide tools to help analyze their local policy environment for barriers that inhibit systems from bringing care to the people. And it looks like our feedback is the last part is key, having local conversations to discover the barriers in the systems when we're poised for that moving forward. And then there is a mouth healthy habits. Is this an existing program? What about Smiles for Life? Use Silk, develop something, utilize existing resources. And Deb, correct me if I'm wrong. I think this term mouth healthy habits actually came from you during one of our meetings. And I think that was really just to convey about, instead of using dental or oral, we're just talking about our mouth and making sure we're taking care of it in a healthy way.
So I agree, Jessica. I don't think it's an actual program or a curriculum. It's just an aspiration. Let's all have mouth healthy habits. Maybe that's too jargony.
Mhm.
Sorry, there you go.
Any feedback from the group on this first one?
If the group is willing to discuss the part about the local barriers, because when the feedback is that that's key. And team, help me if I'm misremembering here, but we have that complication that there's 50 states with 50 different practice acts and 50 different, things, ways or regulations for different things. I know that there's some states that have had really negative experience with mobile programs. So you have to have a fixed clinic within X miles or whatever. And I don't know if it's still true, but I know back in the 80s when Apple Tree was founded, there were states that wouldn't allow a nonprofit dental organization. So I appreciate that feedback, and I don't know what we're poised for that moving forward means, but I'd be interested in what we're poised for that means in the feedback.
Yeah, I remember that was Gail Brown. I know that's the work that they're doing in New Hampshire. I think that she was like, if we had that, we would be using that right now. Like, we're poised.
So poised to use it, not poised to create it, is what the
Yeah,
feedback.
I mean, I think she would be game to jump in. She always is, but
I think this is a perfect example of open, right? Like, how do we get people from every state to kind of, can we gather that information, or does it already exist and can we disseminate it? That's what this collective is about, is trying to bring that to the people. So maybe not necessarily, when we talk about care, what I've learned most recently is the first step to care is educating the people. So maybe that's, the first step is identifying and then disseminating that information to key stakeholders.
And I'm really feeling the tie back to the amplifying consumer voices right now. This is being typed in. Seems like an important link there too.
All right, our second priority was to create a model to host stakeholder town halls to apply new understandings from scientific experts, clinicians, and community members to find consensus-based, tailored, community-centered health solutions to provide access to care options for preventive dental services in non-traditional settings. And then it looks like feedback here is foster opportunities for multi-state collaboration projects. Not hearing anybody jump into feedback, so let's head to the next one. So here we have for our third priority, create awareness and promote promising practices for new delivery models. Examples are teledentistry, school-based programs, offer virtual info share sessions for pediatricians, advocates, clinicians, etc., on different programs and models, considering integration with other services and how to engage with the community. And I think this really ties back to the integration of dental oral health into the other health professions of behavioral and medical, as well as social services. Not hearing anybody else speak up, let's head to the last one. Advocate for policies that support new delivery models and long-term programs to keep non-traditional providers and dental HIPSAs, i.e. allied professionals, teledentistry, school-based programs, including care coordination, behavioral support science, and effective deployment of workforce.
So speaking as a dental hygienist, I would love to see, you know, information shared on how to get these non-traditional providers or mid-level care providers accomplished in every state, right? What's worked in other states, and you know, what policy, you know, it kind of ties in with, I would think, the policy aspect as well, right?
Yeah.
And then can we create kind of a group or something that helps each state utilize this? Because I think it's essential to the access to care issue.
Thank you, because I agree. And at the National Oral Health Conference, there was a very interesting session. Now I'm going to blank on who the speaker was, so anybody that was there help me out. But talking about breaking down all the state licensure barriers and having
Yeah, the Portability
Yeah.
Act for licensure. Mhm.
Yeah. So, I mean, that fits in with it. In a way, that fits in with it. It's maybe not in total, but that fits into this too. And so license portability. And then if you can do that in this state, why can't you do it in that state? And
Right. Having more national and rather than everything being state by state. I believe the American Dental Hygiene Association is advocating for that, the state portability or the license portability.
yeah, that's right. It was Ann Lynch and
Yes. Yep.
something
And
from the National Rural Health Association, maybe?
it may be. Yeah. I've been getting a lot of information regarding that from the ADHA.
I'll see if I can post a link here. Yeah.
But I mean, I don't know who that falls into. I mean, I think it falls into the access to care, but also maybe into policy and maybe even a little bit into prevention, probably all the levers. But I mean, I would like, that would be something that I think would be really helpful. And I think it's out there, right? It's being discussed. And so.
I'm also just now catching up with the chat box, so I'll make sure those notes make it into the chart. Any other thoughts for our final goal here today? Awesome. Well, what do you guys think of this overall so far? There's a lot of overlap, right? A lot of weaving to do. Any high level takeaways that you want to share out? I guess we can just do this up for this whole discussion. So overall, this whole massive strategy, and there's a lot of links, there's a lot of connections that we are intentionally calling out for all these teams to make together. But so when we look at this big picture and we're thinking 5 years down the road and all of these strategies are well underway and they're producing the outcomes that we want to see, what is the story that we want to tell? And considering that, how do we want to document that? What could we do to mutually reinforce these goals, right? And what would shared measurement look like between us for the network and for each of these goals.
At the very end, I think, in my opinion, we want to tell the story that actually many people are now receiving oral health services in the community. So bringing care to the people is essential. How are we going to actually not only, be very good in working with ourselves, but how are we going to bring those very needed services to the regular people? That is in my opinion, the thing that will make us really feel that we accomplish something.
Thanks, Beatrice. What do others think?
And just let me add something else, because yesterday I attended an event with the Asian community, and I had a conversation with a physician that actually had a health clinic, a free health clinic for the poor. And as a doctor, it was the first physician actually that had a dental chair in that setting, so that he could provide dental care to the patients. That conversations with him impact me, and I think that is in reality, what we're talking about, because although I really would like the technology to be so good that we're talking about all the things that we can ideally accomplish, like saying bringing healthcare in settings that are high tech. At the end is like, how many people are going to benefit from services, and that was a good example to me.
This is Vanessa. I just want to amplify to echo what Beatrice just said. I think that's a great story to tell. And it just reminds me of, for those of you who were with Open way back in the day when we had frameworks working with us. And I think that your point, Beatrice, is really well taken. It's like we're giving people the keys, we're giving people the keys to access. And that's part of like bringing, it's not necessarily like bringing care to the people, but but just opening the door to access. So I really like that idea, Beatrice.
This is Heather. I agree. A successful story would be people are healthier, right? I know that's kind of broad, but when it comes down to it, that's our goal, right? All of these things are the goal, is to have a healthier nation, and to help people.
Good point, Heather. What if we worked on sort of a national level to build affinities with other professional groups? So for example, we talk about how we can, what are some things we can implement statewide? So we go back and we work in our state. But what if we worked with, for example, if we talk about integrated care, what if we work with organizations like Open for physicians, assistants, nurses, on a national level, so that all of a sudden, it's kind of a goosebump thing. Like all of a sudden, all this stuff is going to happen nationwide. It's no longer a statewide effort. Do we have affinities with different professional organizations like Open already?
Is there anything else like Open out there? I mean, when I found Open, I was like, wow, this is amazing. I've never heard of anything like this going on. But I mean, yeah, that's goosebump level there. It's like, wow, if we could all, if you could integrate all these Open concepts any big impacts. Whew. Francis, do we know of any others out
Um,
there?
So there are other networks and associations, different groups out there. I mean, like you already talked about the American Dental Hygiene Association, right? Like we have a lot of partners that are at the table from different affinity groups already. So open is kind of like everyone unified around oral health for all. But I'm sure we can tap into, and I think that's even like with the Amplify Consumer Voices, it was like we want to strategically identify and partner with all these different types of groups. And I think that's at a local level, state level, national level. So when we dig into that work, I would probably, get specifically into like who do we already know is at the table, and then who do we need to reach out to. Um, so
That would be awesome because they could be sitting somewhere wanting to have us at their table as well.
So true. So true. And I think on a smaller level in the work I'm doing with Anthem and Indiana Medicaid, it's the same thing. You know, we're working with IFCA, we're working with these agencies that are representative of the physicians, are representative of these other groups.
what are
Oh,
some, oh, sorry, go ahead.
yeah, I also wanted to bring up to, I think in our group, we also had at the very bottom of the lists in the poll that people, shared with us, that we have to look for unusual settings in which, we may expand. And I think that is a great idea. And, basically we're thinking about medical offices and so forth, and that is great. I think to partner with the free healthcare providers so that they could bring, say, uh, uh, dental care for the people in communities, and to have, say, town halls or things like that. We can educate, but at the same time provide some services to the people. That's ideal. But I also wanted to bring up one more idea that I had, and that I actually discussed with the ambassador of Mexico in Washington, D.C., because I was invited to have a lunch with him. And I was telling him how important it was for them when they provide services to the Mexican community, for example, in which they bring services for the community to do passports and update, births for people, it's certificates and so forth. And I know that they have a health window in which they provide at least some information regarding health. So I asked them, that if they would be interested in having, say, information regarding oral health in Spanish that they can be, sharing with people as they are waiting for their turn. And they have thousands of people that they see. I mean, probably I would say every day. To give you an idea, the Mexican embassy has, I think, 50 consulates at least in the whole United States of America. And they see, people in each one of those offices. So they have already offices, and they have the system to transmit information to the people. So what we need to do is maybe produce information that we can share with them so that they can share with their public. And I was telling the ambassador if he knew that Virginia just recently approved dental services for people with Medicaid. He didn't know that. And I told him, well, the same way that you don't know, many of our community that maybe are recipients of Medicaid don't know that. So we have to tell them. So what I'm saying is, who are the little hubs in which, people, gather and can help us disseminate not only, health information, but the services that they're able to get. that's just another idea.
Wow. Okay. I was going to type this in the chat, but Beatrice, then you wouldn't be able to see it. You are amazing. I love your idea. And you were just visiting with the ambassador to Mexico. And didn't you just have lunch with the wife of the governor or something? Are you like the most connected to celebs and powerful people person on this group?
Yes, she is.
My husband is my driver. No, I think I'm just, trying to expand in the unusual settings that I can serve my community with. But, I know that the Mexican community is pretty strong in America. It's probably the largest population in the country. But I'm just trying to see where can we really insert the information that we want to, pass along to the community. So, and I know that I'm going to keep pushing back. And if we have a way in which we can produce things in Spanish and have that information, I know that they would probably disseminate it across the consulates in the country. So that is one place that I know. So I'm using whatever resources I can think of. So, that's all.
My comment was a compliment.
Thank you. Thank you. That's very kind and generous.
So we do have one more agenda item to get through, which is leveraging our time at the mid-year meeting. So I want to have enough space for that, but I want to check because we haven't really talked much about shared measurement system. But do you all feel like you have enough to go off of right now to go back into your lever teams and have those discussions to get to the final Smarty goals that we're asking to have completed by June 17th? So do you feel like you have enough that you'll be able to weave in some metrics, how we measure, or do you feel like we should spend some more time talking about that as a full group right now?
I think the silence is telling us that we need another conversation, to tell the truth. I mean, to really fine tune how we really link to one another. And frankly, another thing that I want to share with you is that my presentation last time to the NEMA group really enlarged my thinking that we have to every month make sure that one of us in these lever teams is connecting to the larger group, because like I shared to them, when they think that we are the lever groups and so forth, they may think that we will come up with the solutions, but it's actually a common work, and we will need the 3,000 members in the community. So my suggestion is that we not only get back with each, with the group here again, and then maybe also intentionally make sure that we connect with other groups so that, the ROC can connect us with, what are the states that we need to talk to, each one of us, and make sure that one of these lever members is somehow connecting with everybody so that we can get that feedback and nourish the work.
Yeah, as far as measurement goes too, are we able to work with like the data measurement team and kind of pick their brain on what they think would be a good measurement metrics for our projects?
Yeah, absolutely. I think that they would love to dig into that. We have a lot of data nerds in this network, so I think we could put a call out.
Yeah, I think that would be best, because I think from what I've seen of their work so far, it seems like they're pretty up to date on it, and it might be something that I just, when I start to think about it myself, I'm like, oh, there's so many different things we can measure and what's relevant and what's most important, right?
Yeah. So many. Yes. Also, I think that's a good segue too for if we're leveraging the mid-year, right? And we want everyone to engage in this collective impact work. We may use the time to identify what are our common indicators, what are the research questions that we want to ask, like the whole, what is the big story we want to tell, and then linking that to our members, right? The individuals and the organizations that are at the table, so that their story can now include this larger story, and perhaps vice versa. But we know we want to avoid duplicative efforts. There was another, if you recall, that comment that came from NOC to survey members for whatever already exists. But so those were the initial ideas, the initial thinking. But we have 2 50-minute breakout sessions. So folks will be able to pick a lever, go there for 50 minutes, and then there will be a break, and then it'll be the same thing for a second round. So with that 50-minute time we have, and we're going to set people up. I think we have like 30 minutes prior to set folks up. And the blueprint will be woven into the whole agenda. We have a keynote speaker. His name's Paul Schmitz, if you know him. He's from the Collective Impact Forum. So he's going to do a deep dive into this work. And then the time is open for us to kind of say, what do we think would be the most effective use of everyone's time, and to get whatever it is that we need to be able to finalize this work. So if we want to maybe dive into what would that look like, those 2 50-minute breakout sessions. We also have a room available for a pre-convening for this team, if that's something that we want to take advantage of. So that's July 12th. That's the starting date of the convening. So the convening starts, I believe, at 1 p.m. or maybe 2 p.m. So we would have a room from 9 to 1. So that's also on the table. We don't necessarily need to make a decision about that right now, but I'd be willing to design an agenda and get you guys set up for next steps following the convening. But so that is on the table. But for right now, how do we leverage this time together? What thoughts do you have?
An in-person meeting, I think that would be really valuable to me, but I don't know the time for everybody else. But that seems to me that we need to connect also personally, and
If Beatrice is going to be there, I'm going to be there, because you never know, it might be an ambassador or a governor or somebody, so I'll be there.
I agree having I know you said the pre-meeting is on the table, but just trying to meet with everybody and kind of get everything, last minute questions answered prior to the start of the.
Yeah, that'd be good.
I just feel like that would make me feel more comfortable going into the week or the couple days.
Awesome. So
It makes sense to schedule it. Sorry to jump in, Francis, but it makes sense to schedule this if we rely on the fact that most lever teams will be there. Do we have an idea? Well, I haven't seen a poll or anything, but do we have an idea of like the attendance?
Does everyone want to thumbs up, thumb down real quick? Yeah. Is there anyone that is a thumbs down? Nice. That's so many thumbs. That's so encouraging. Right on. Haiwan, is that you? It just came off mute. No. Okay, so then we're doing it. We'll do it. But so for the sessions themselves, those two 50-minute sessions, what initial ideas do you all have? And keep in mind, we can use this time to survey folks for what already exists. And then also we're trying to align with their efforts. So what would we use that time? How can we kind of frame it and guide the time together to get to the best outcomes?
So when you say the breakout groups, does that mean the lever teams will all be together, or each lever will be broken out and with the attendees? What exactly are we talking about with the breakouts?
Yeah, so all attendees will be there for like a 30-minute setup session. I know like earlier in the day, we'll be doing like from OH 2020 to open and the kind of progress to where we are now. And then the 30-minute setup prior is just like deep dive into not really the process, because we've talked about the process to date so much, but just how this has been a network driven initiative, that this is all the feedback that's been collected, and this is what it boils down to. And then we'll break out, and then each lever team will have their own area, like probably their own room. And so you can do a deep dive into your individual lever after everyone gets like kind of grounded in the full big picture.
And will they be picking where they're going, or they'll be assigned, or how are we breaking out?
So they will be able to pick, and I know in the registration, folks, I think it's to, go, what's your first choice, second choice.
Okay.
So we'll have an idea of how many people will be there ahead of time, but I think people do get to vote with their feet. I don't think that they're bound to their first or second choices.
Okay.
So I'm sorry, this is Deb, and I'm sorry if this is obvious to everybody and not to me. We are being guided to hear from them and find out what they're doing. We know what we're framing, and we want to populate it with the good stuff from them, right?
Yeah, that's what's kind of on the table right now is yeah, would that be the best use of our time? Is that collecting what folks are up to, or is there a better way we could use our time?
Well, I personally think that would be a great way to use our time to make those connections and meet those people and all that. What I don't know, are there some cool, not party games, but technologies or ways that we can do that, to interact in a, yeah, it'd be fun to have it be a little fun too, and just use something that captures stuff to go forward with. I didn't really mean party games. Take the party games out of it.
Are you talking about like interactive polls and things like that?
Yeah, or when we did it, the virtual, we had the jam boards, or just something that, yeah. I don't know what the right ones are, but I would like to have something like that.
So Deb, if I'm hearing you correctly, this is Jessica, like doing almost a live jam board of where you've got the white paper, or you just have a section of wall and you have your area with your priority, you have a topic conversation, and then people have sticky notes and they go stick their sticky notes on the wall to give us our feedback. Is that kind of what you're talking about?
Or a way that doesn't require if it's a poll thing that people get to,
on their phone.
Yeah, maybe if we're
Gotcha.
an app or something where it can get in there automatically.
Yeah.
I don't know the technology. I guess that's conceptually, yes, but it would be fun to have it be, unless there's somebody that really likes capturing all those sticky notes and doing whatever with them.
Okay, and there's two of these 50-minute sessions?
Yeah, so you would just repeat so folks can do two levers.
Okay.
Yeah.
So we're trying to think of what we're going to have. Okay.
Just from being an attendee at various types of conferences, I think as we're planning, we need to remember to keep it simple. That 50 minutes is going to go really, really fast. So maybe just even the two ideas, Francis, that you already had in today's agenda of identifying like a common indicators and research questions, or surveying the members, that might fill that 50 minutes. So maybe having like a third area that if we go fast, we have something to fill the time.
So could we do something like virtual, like set up some sort of where they're allowed to share what they're doing that they may think is relevant or helpful to what we're doing. So obviously we can't probably go through every single person in the room and see what they can help us with, but maybe there's a survey that goes out where they can do that, or something where they can say this, this is our contact information and this is what we're doing and we think it would be beneficial. Because maybe, maybe some people are coming to learn what we're doing and other people are coming to because they have ideas and things like that. And rather than us trying to reach out individually to all of them, can we develop something where they can kind of write into us and we can review that? I mean, I know there's email, but I feel like maybe we could do something that they could leave with, since that 50 minutes is going to go by quickly and we're not probably going to get a chance to talk to everybody.
For sure. Yeah, we could set up like a survey or a poll or whatever it is. And I think that's great too, if everyone's kind of like sharing what they have and then everyone can access it to also like, there's all these models, all these tools, all these resources, right? So definitely.
Right, because I know with our lever, a lot of it is trying to find out what everybody's doing. Like, how can we identify these models? And I know, we're talking about having, the support staff at Open look for those models. But man, if we have all these people coming and are interested already, if they can submit their models or submit what they're working on, I mean, that would be a really good way to gather information.
Bianca just posted that we're working on a visual where attendees can add what they're working on via lever. So, sounds like we're all on the same page.
I'm just really impressed with all the alignment so far in all of this. Like it has exceeded my expectations already, even before Smarty goals are finalized. So I hope others feel the same way. So what other thoughts do we have about our time together at mid-year? Is there anything to ensure that we want to lift up? It sounds like we're feeling okay about establishing some common indicators and research questions so we align with, what's out there, that we're not reinventing the wheel. And yeah, we'll be able to survey and get some good data out of the deal. Are there any other thoughts there? I am also mindful of you East Coast Warriors and what time it is, so so it's okay if we don't, if we puttered out. So if we're ready for next steps, we do have a meeting evaluation. As I mentioned prior, we're asking for all SMARTY goals to come back by June 17th, which is important so that we meet our printing deadlines and getting everything ready for the July 11th is when we'll be there. And the 12th is when it kicks off. I will put together a draft agenda for you all to make sure you have opportunity to weigh in for that pre-convening time. And then the step coming after this, after SMARTY goals and sharing everything at mid-year, we'll move into a learning agenda. So more on that, but I will drop that link for this meeting evaluation. Were there any other thoughts to include? Do we feel like we've done it? Are you guys, do you feel good about your next steps? Awesome. You guys are wonderful. Really appreciate you, all of your hard work, all of your diligent efforts. So be on the lookout. I'll get these notes out and then we can start coordinating our next calls. Okay. Thanks, everybody.
Thank you.
Thank you. Great meeting.